Good morning. Well, I have the honor and the privilege to introduce to you. Thank you. We're going to keep on in our agenda. So I have the honor and the privilege to present to you Kira Fortune. She's the advisor on social determinants of health from the regional office of WHO, which is PAHO. And she will be talking to us on bringing different sectors together for addressing the social determinants of health. So thank you, Kira, for being with us this morning. And you have around 20 minutes to present your topics, and hopefully we'll have some time to discuss and have some questions. Thank you, Kira.
Thank you. Thank you very much. It's an honor to be here today. And of course, I also want to thank IMO for inviting PAHO here to share the work that we're doing in the region of the Americas. I do want to stress that we are the regional office of the World Health Organization, and we operate in the whole of the region. So of course, I was delighted to hear the need to really address a global perspective as well, which is what I will be doing today, primarily the regional perspective. And of course, I also want to say that given that I am the regional advisor on the determinants of health, it has been an absolute pleasure to listen to the discussion this morning. I must say it is absolutely music, not only to my ears, but it will also be music to my colleagues' ears when I go back to the office after this session. What I'm going to do, I have quite a tall order. I'm going to talk through four aspects today. I have about 15 minutes and 15 minutes for discussion. I'm just going to give you a very quick snapshot of what this very diverse region of the Americas look like. And it is indeed very diverse. So again, that's a very tall order. I will speak a little bit to PAHO's mission, in particular because when we talk about equity and the social determinants of health, that is something that our member states have made very clear that that is a core priority. And historically has been a very core priority for this region. Again, addressing health in all policies, which we consider as a tool to really implement the real political declaration on the social determinants of health. And then, of course, what I really want to do is to identify some of the core windows of opportunity we have now in terms of collaboration, but also in terms of the windows of opportunities we have, not only at the regional level, but also at the global level, to really sort of address inequities through the health in all policies tool, as well as by addressing the social determinants of health. So, as you all know, we are coming to an end to the Millennium Development Goals. Currently, the global community is negotiating the new Sustainable Development Goals. That will be negotiated next week in New York. It's very exciting. And it's important to say that at the close of the Millennium Development Goals in the region of the Americas, we have seen significant progress. We have seen that we've seen a reduction in extreme poverty. We have seen an increase in life expectancy. And we're also seeing a low rate of child malnutrition at around 4% and high immunization rate against measles at 93%. That is just to also start on a positive note, because we do have challenges. And again, if we look at it from a global perspective, we know that 2.2 billion people worldwide live on less than $2 a day. And we also see stark differences in economic opportunities. If you are a child born in Malawi, you are likely to live less than 32 years, than a child in Japan. And if we go a little closer to the Americas, you will see that life expectancy in the Dominican Republic is 73.5, whereas in Haiti is 62.2. So within the same island, you see a significant gap in terms of life expectancy. And if, like myself, I am from Denmark, but I live here in DC, and I commute on the Red Line most mornings when I don't take my kids to school. And you'll see that even here within DC, that within 17 metro stops spanning 30 miles, there is an estimated 9-year difference in terms of lifespan. So again, you will have seen this data before, but that's just to remind ourselves that we do indeed have significant challenges. Again, I just want to go back to Latin America. Latin America, you will know from, you know that this is a region that has certainly has seen a lot of growth in terms of economic terms. But it's also important to stress that despite it being a middle income region, it is actually the most unequal region in the world. And you will see here from the table prepared by a colleague of mine that despite the fact that you've had growth significant growth over a period of 30 years, the gap between those who have and those who have not has also increased significantly. We are seeing a number of challenges in the region. In particular, we are seeing a high prevalence of NCDs. The epidemiological, this is my Danish coming through now, the epidemiological profile is changing significantly, and it's also the most urbanized region in the world currently. What is important to point out here, and again, you're all familiar with the social determinants of health, but I always like to show this slide because we know that a lot of those issues that we're seeing in terms of NCDs, we know that the health sector alone cannot address those. And if you think about the different determinants of health in terms of NCDs, you know, they are all there in terms of social exclusion, gender, employment, gender norms, issues that that really does go beyond the health sector. So again, it's important to bear that in mind. Today we are talking about education. Really what I'm very familiar with is more in terms of how we get the different sectors together. But of course I also want to highlight that we have also heard here today that both access to and quality of education in the LAC region are strongly influenced by economic status. Educational outcomes are often influenced by gender, ethnicity and other factors. And school outcomes within the region vary considerably when compared with high-income countries. So just to draw your attention to this data as well. I've now set, again, at a speed rate, some of the very complex challenges that we see in the region of the Americas. I want to, again, just highlight the fact that the Pan American Health Organization is an intergovernmental organization. Our 38 member states really set the agenda and the priority. Historically, equity and the social determinants of health has been absolutely central to the agenda. And I say that because you will see that even in our 5-year strategic plan that was negotiated recently by our member states, you will see that we are accountable in terms of addressing inequality, in terms of addressing the different social determinants of health. And you will see that we actually have very specific indicators on that, and that we have to report back to our member states every 6 months. So I just want to highlight that it's something that it's very much mainstreamed, it's been institutionalized in the sense that we have to be accountable. I want to highlight the Rio Political Declaration. We heard today from our sponsors that they are keen to do something like the 9 knowledge networks that was established by the Social Commission on the Social Determinants of Health. And of course, as you know, that commission was established in 2005, and they published their report in 2008. In 2011, member states met in Rio de Janeiro in Brazil, where they actually looked at the evidence. They looked at the progress made since the publication of the Commission's report on the social determinants of health. And they wanted to see in practical terms what had countries done to address those different recommendations. During that conference, the Rio Political Declaration on the social determinants of health was agreed upon by member states. And I mention that because this consists of 5 core pillars: that of participation, the role of the health sector, global action on the social determinants of health, such as the MDGs and the Sustainable Development Goals, governance, as well as the need to monitor progress. Again, I mention that because this is really what informs our technical cooperation within PAHO, but I also mention that because in that declaration you will see that health in all policies was actually defined by member states as the tool to implement this particular declaration. So that's why you're going to hear me as well talk a lot about health in all policies, because that is very much how we operate. So, of course, we're very excited to also share with you that the region of the Americas was actually the first region in the world to adopt a regional plan of action on health in all policies. And the reason why that was developed was that, again, member states we now have the evidence, we know what the issues are, how do we do it? We want to see practical tools, we want to see practical action. And this, based on that, and this came out of a regional consultation we had with our countries, this particular plan was developed through a number of consultations, not just with our member states, but also with a number of stakeholders, our collaborating centers, universities. And here you have it, we have this plan of action that consists of 6 lines of action. In order to make sure that this plan is implemented over the next 5 years, we conducted an expert consultation very recently with more than 65 experts to look at concrete actions. How are we going to implement this plan of action? Out of that we have a lot of evidence that we would like to share with you, including a white paper that we are about to publish, but also an indicator analysis, which again really sort of is developed with the thought of supporting countries who want to sort of implement this. Also very important is that we actually established a task force and a working group specifically overseeing the implementation of this plan, but also making the linkage with the Sustainable Development Goals. And I'm going to talk about that a little later, because this is a very unique opportunity that we have as well to really make sure that the evidence we have, the challenges that we have, is really reflected in those kind of discussions. We have wonderful, wonderful evidence in the region of the Americas. I really appreciated the comments about we really need to learn from what is happening across the world. There is wonderful, wonderful evidence. What sometimes happens in the region of the Americas is a lot of the evidence is written in Spanish, so it doesn't always reach our sort of policymakers across the world or other audiences. So that's something that we are very much aware of. But again, just to sort of also address here, I've just providing 3 specific examples from the region. Chile, which is very famous for its program on Crece Contigo. What is very particular to this particular program is that there is a specific focus on early childhood development. Costa Rica, again, has been very instrumental in really investing in social public policies, education being one of them, and again has been very successful in addressing different social determinants of health. And Brazil, you may be familiar with the Bolsa program, which actually managed to take out 40 million people out of poverty, and a core component here as well was that of education. And what is very significant about those 3 particular programs is that they all, again, it was decisions made at the highest level of government, and it was different sectors really coming around the table with one common goal. And I think that's something that we need to be very much aware of, because as was said earlier by our sponsors here, social terms of health has been around for a long time, but we still have this challenge of really sort of aligning and collaborating. So again, something that we need to be very much aware of. Measuring both education and health can tell us how development is advancing the 3 pillars of sustainability: social, environmental, and economic, particularly with respect to equity-related objectives. And seeking synergies between health and education has, of course, benefits for both sectors, such as healthier students are more likely to attend school. We heard that earlier on as well. And schools can act as central resources for health information, skill building, and services. Education and health are, of course, closely related. Universal access to education, one of the most powerful determinants of child well-being, health equity, and development. And the health sector needs to really continue strengthening support for and work with education actors as well as other sectors. It's very important. And there are many entry points for health stakeholders to work with education stakeholders. Some of the opportunities that we have right now, a core opportunity, I would say, is, of course, the new Sustainable Development Goals. This is really, and what we often say is this is really the exercise, a true practical health in all policies exercise. This is really where all the sectors have come together to negotiate these 17 goals that will be with us for the next 15 years. So really defining human development for the next 15 years. It's really an opportunity for us to really put focus on sustainable development, health and all policies, equity, the social determinants of health, education, and universal health coverage. If you have been following these debates, which I have very closely, I feel at the moment that I'm eating, drinking, and living the Sustainable Development Goals, you will see that there are a number of targets that have been defined that are very, very relevant to our discussion today and to the work that's currently being conducted by yourself. And some of these are just some of those targets that, that we can really think about in terms of how we can come together with different sectors. I just want to tell you very briefly what we are doing at PAHO. What are we concretely doing? So this, sometimes people think this sounds very, lots of conferences, lots of targets, and what does that mean in practice? Let me tell you what we're doing. I mentioned our regional plan of action, health and all policies. At this point in time, we are really focusing on capacity building. How do we implement this agenda? We are also the first, you may be familiar with Ilona Kickbush. Ilona Kickbush is really the queen of health and all policies. Ilona Kickbush has, with WHO, developed this training manual on health and all policies. And we are currently implementing this manual in the region of the Americas. We were recently at the Institute of Public Health in Mexico with a large group of Latin American researchers and collaborators who will help us in sort of scaling up this training within the region. And we're going to have a next training in Brazil in November. And very, very importantly, I want to share with you that in the region of the Americas, we are about to initiate a regional marmot review. So we heard earlier about the need to really sort of learn from the Commission's work. We're about to do a regional review here in the Americas with 12 countries. And I think this would really be an opportunity for us to really work together as well. The focus here is going to be on gender, on equity, on human rights, and on ethnicity. But it's also really a way to really get different sectors together within the region of the Americas, including education. So I think this is something for us to really think about as well, how we can collaborate. Again, I mentioned that sometimes we have rich evidence in the region of the Americas that's not always shared. So that's very important for us right now to really document what exists so that we can really learn from one another. And that, when we kind of develop initiatives like this, that we can really see what's happening around the world and what works and what does not work. We are also in the process of developing equity profiles. This is done by a colleague of mine, Oscar Mujica, but this is also really a way of really collaborating with other sectors, including that of education. And then I mentioned that we have established a task force on the Sustainable Development Goals and health and all policies. This is very, very important because this particular task force is also identifying the core opportunities that we have in terms of really identifying where we can work together with different sectors. We recently met, and we now again have a very specific work plan. One of them include taking advantage of the implementation of the 17 Sustainable Development Goals. And what the task force has proposed is that this is really a way for us to identify different sectors where we can come together and find a common objective and really collectively develop a proposal that will have long-term impact. Again, we have a number of initiatives in the region of the Americas, and I'm going to finish here. I mentioned that we had our expert consultation in Washington. Again, this was an opportunity for us to also hear from other sectors what works and what doesn't work. We heard earlier the need for language. How do we actually interact with other sectors? That is our biggest challenge, and I can tell you we need to be much better at that. When we actually held the conference in Rio on the social determinants of health, the idea really was that this was going to be a conference for all the other sectors, where we could learn from all the other sectors. And I can tell you that it ended up being a health conference, because despite the fact that the invitations were sent out through the Ministry of Foreign Affairs, when they saw the social determinants of health, it went straight to the Ministry of Health. So it's just to say we have some structural challenges that we really need to think about. I heard earlier as well, we are in this room, we all peers, we all agree that this is, we care about the social determinants of health, we're very passionate about it. We need to be better at engaging with other sectors and think about our language as well. I can tell you that our Brazilian colleagues made a proposal that we shouldn't call it health in all policies, we should call it equity in all policies. And of course, this will raise different issues and challenges, but just to say, we need to think about how we can be more inclusive in terms of the work that we do. I think my time is almost up, but again, I just want to highlight and draw your attention to the fact that we are going to have a regional forum on urban health coming up in December. The central theme here will be that of health in all policies, and what we're going to look at is very much learning from the local experiences of implementing health in all policies, addressing the social determinants of health, and really hear from communities what has happened at the community level. And we have these different conferences coming up where we're going to report back all these different experiences, evidence, and progress that we have made in the region of the America. On that note, I think my time is up. I want to thank you for your attention, and it's lovely to be here. Thank you.